Hi, and welcome to the Breastfeeding Medicine Podcast. I'm your co-host, Dr. Ann Eglash. I'm a clinical professor in the Department of Family Medicine at the University of Wisconsin School of Medicine and Public Health and a board-certified lactation consultant.
And I am your co-host, Dr. Kathy Leeper. I've been a breastfeeding medicine specialist since 2001, and I'm currently practicing in Nebraska and Kansas.
This podcast is produced and edited by the Milk Mob and is co-sponsored by the Academy of Breastfeeding Medicine. Are you ready to go? Perfect. So what I'm going to talk about first is an article that was written by Phil Anderson, who's a pharmacologist specializing in lactation. And he started writing these columns, I think it seems to me like once a month in Breastfeeding Medicine Journal, doing a LactMed update. And as you and I both know, LactMed is the database that's with ToxNet, which is from the National Library of Medicine, and they review substances. Oh, go ahead.
I was going to say, and it's awesome.
And it's awesome, absolutely. Yeah, I mean, it's really my go-to resource for anything, and I love sharing it with families and other doctors. Yeah. So in the 9th issue of the 2016 Breastfeeding Medicine Journal, he has an article that he entitled New and Unusual LactMed Topics. So the first topic, it was on new insect repellents that are out there. And even though it's February and I'm looking out my window and I see a bunch of snow, I thought it would be really fun to talk about insect repellents because it just reminds me of like those really great evenings when it's like finally cooler and there's a nice breeze and it's like, darn, there's mosquitoes, but gosh, it's so nice out here. So I thought I'd talk. So to me, it's been really exciting to see these new insect repellents out there because, as you know, maybe you don't know, but in the state of Wisconsin, we consider mosquitoes the unofficial state bird. And
we said that when I was in Minneapolis too, so I think it's more than your state. But
well, we kind of share that because we're the the land of lakes, and so is so is Minnesota. So yeah, with all these lakes, is just standing water galore. And DEET is the old standby, but for years we always counseled parents. As a family doctor or pediatrician, we always counseled parents to make sure to use the least amount of DEET for infants and children, even though now LactMed and other groups like even the Environmental Working Group state that DEET is probably not as neurotoxic as we once thought. But nevertheless, there are these new insect repellents out there. One's called IR3535, which I think is really a funny name for a drug. The other one is called picaridin, and the other one is oil of lemon eucalyptus, which actually comes from that's the name of a tree that's in Australia. And according to the Environmental Working Group, both picaridin and IR3535 are probably as effective as DEET. The oil of lemon eucalyptus is probably not as effective, but the bottom line is that LactMed considers all of these substances, all these insect repellents safe during breastfeeding, even the high concentrations of DEET, like I think we have like a 35% DEET that we use when we go camping. And quite honestly, I don't think it really works as well as it should. So I'm excited to try these other things. But the bottom line is that we can, what they're saying is that we can tell breastfeeding mothers that whatever they're using over the counter, that's just that you can buy in the drugstore is probably fine for breastfeeding, and she doesn't have to worry about it. And she can also use it for her infant as well.
Great.
Yeah. The next category are cancer chemotherapy agents, and Dr. Anderson mentions that there are some new oral ones that are probably safe during nursing. And I think this is really great news because we oftentimes, when we lecture or educate physicians, we oftentimes talk about chemotherapy as substances that are generally contraindicated during nursing. So these drugs are called STIs, or signal transduction inhibitors. And one of the commercial names is Gleevec, Gleevec. And there are actually 37 of these on the market, which I have not. And I don't know. I mean, now that cancer chemotherapy has just gone through so many renditions of, new medications and targeting, genetic variants, it's really hard as a family doctor to keep up with all these. So I don't know if my patients have used any of these. And obviously, cancer meds are a huge business if there's 37 of them out there already. But
Mm-hmm.
the bottom line is that they're very highly protein bound, so they're not very likely to be transmitted into breast milk. And there have been already a few documented cases of breastfeeding mothers taking these meds during breastfeeding, and the babies were fine. So that was pretty exciting.
Yeah.
I think one case was a mother who had chronic lymphocytic or lymph,
Myeloid leukemia.
oh my yeah myocytic leukemia. Right. Thank you.
Mm-hmm.
Okay. And then another topic he covered was tattooing. And he states that there really has not been much research about the safety of tattooing during breastfeeding, but the concerns about tattooing are the transmission of the pigments to the infant via breast milk and also the risk of infection. So in a tattoo situation where it may not be like a legitimate tattoo parlor, where there could be a risk of transmission of HIV, hepatitis B, and hepatitis C through the needles, obviously that would be a risk for the infant. So, in general, like this was a pretty short statement, but he said that LACMA generally recommends not having a new tattoo done during breastfeeding. Now, I think I don't know, I mean, I guess I don't know how many breastfeeding women have tattoos during breastfeeding, but
Mm-hmm.
at our institution at the UW, at the University of Wisconsin, we do have professionals who do tattooing. Um,
Ah.
And so unless they're just removing the tattoos, I'm pretty sure they're doing tattoos in a very safe way. So then the question is about the pigments, I guess. We just don't have an answer to that. So I guess it's just for people to know that the party line is still to consider waiting on tattooing.
That sounds reasonable.
Yeah, I guess it's not like it's an elective, it's an elective surgery, right?
You might change your mind on what you want to have anyway by then.
That's true. That's true. That's a good point. Um, And then dialysis was another topic. And he pointed out that some breastfeeding mothers are on dialysis. Some of these cases looked at the nutrients in breast milk when the mother's ready for dialysis. So when her, you know, various metabolites have accumulated and she's ready to be dialyzed again, the thought is that the nutrients do look different and may be out of balance. So the
Mm-hmm.
recommendation is to consider having mom breastfeed after dialysis, which I think is which I think is a tricky thing because the way dialysis works often for my patients is that they go in Monday, Wednesday, and Friday. So it
Mm-hmm.
seems like maybe Sunday might be the day that they might have more imbalance. I think we need further studies on that.
Yeah.
So I just wonder if maybe electrolytes need to be checked in infants when they're nursing and mom is undergoing dialysis. It's hard to say because it would be difficult for mom to let's say on Monday, Wednesday, and Friday after dialysis she can nurse, and then on Tuesday, Thursday, Saturday, and Sunday she has to pump and dump. So it's hard to understand really what the recommendation would be there. But probably to
Yeah.
know that maybe doing periodic chemistry panels on infants if moms are being dialyzed would be a good idea.
Yeah, thankfully that's probably a pretty rare circumstance, but yeah, you could also argue that the baby should be able to regulate their own electrolyte status,
Yeah,
so they're healthy.
right. Just like if you give a kid a pickle, like a
Yeah,
6-month-old a
right.
pickle, and he gets a huge load of sodium, he's going to excrete it, right?
Right.
So, yeah,
So,
that's a really good point
interesting.
too. Yeah. So the question is if there's anything that's missing, but it would seem, if
Mm,
anything, there's going to be more of everything. Before.
intermittent.
Yeah,
Yeah.
yeah.
Hmm.
The other topic that he brought up in this article is this issue of TENS units. And so the TENS units are those transcutaneous electrical stimulators that stimulate the skin. My patients typically use a TENS unit for chronic neck or back pain, and they do like
Hmm.
them. They feel like they do help. But then he mentioned something about how TENS units have been used for nipple stimulation when inducing lactation, which I thought was like,
I
um,
never heard of that one.
I know that is so unusual. I need to look up those articles and see if this was like before the creation of the breast pump or something like that. But it
Oh
shouldn't be
no.
because I think a TENS unit postdates a breast pump. I don't know.
Mhm.
So that was interesting. But basically, they're saying that, look, it's fine, it's safe to use during breastfeeding, which
Yeah.
I don't know why we would think that they wouldn't be.
Mhm.
And then then he mentioned something about radiation, and he mentioned that women who have radiation to one breast will not make much milk or any milk from that breast, which is really the party line that I tell people anyway, is that if one
Mhm.
breast is irradiated, it's actually irradiated. The radiation is meant to kill any sort of cells that could become cancer, which
Mhm.
often is glandular tissue.
Right.
And then he mentioned that some women undergo radiation for other reasons, like for Hodgkin's lymphoma, where the radiation is directed towards the mediastinum or into the chest cavity. And so there is some radiation that will scatter and hit the breast as well. And maybe that's
Mhm.
improved over time now that there's, much more targeted radiation and they can avoid all the scatter. But generally,
Mhm.
those women have less exposure of radiation to their breasts. So there's still a risk, but it's much less than if their breast is actually irradiated for breast cancer. And
Mhm.
then we had that interesting topic that came up on the Academy of Breastfeeding Medicine listserv recently with someone posting about management of a woman who had brain irradiation, or maybe she didn't have irradiation, but she had hypopituitarism.
Mhm.
Her pituitary didn't function well. And then some people piped up about, women who've had irradiated pituitaries. And so basically, the bottom line is that if a woman has had brain irradiation, which she may have had as a child for something like brain cancer or leukemia or lymphoma, there's a good
Mhm.
chance that she will not be able to kick in that prolactin, um,
Right.
and may have other issues like growth hormone and thyroid issues, of course. And so those are going to get evaluated when she tries to become pregnant. Um,
Mhm.
but with and she may become pregnant because there are means of, she can, means of doing in vitro fertilization, and then, she's a carrier. But then with lactation, there could be difficulty, right?
Right.
Yeah. And then the last thing that he mentioned was about total parenteral nutrition, which we call TPN. I think some people call it another term in other places. And this is basically where women receive their nutrition through the IV. So for some reason, they're not able to eat and use their intestinal system for food. And so there was a case report of 4 women who used TPN, and they were able to breastfeed either fully or partially. And I guess there was a comment about maybe partial breastfeeding happened because the supply was low because of nutritional
Mhm.
challenges for the mothers. But basically, it's fine to breastfeed while women are on TPN.
Great.
And that would probably be the case too, like if a woman's on, just on like oral gastric feeds, like Ensure, like just the oral formulas for
Mhm.
feeding. It would seem to me that the work that's been done to make sure that those are nutritionally adequate would be sufficient to for mothers to breastfeed on that stuff too.
Sure.
Yeah. So that was that. I really enjoy his column. I'm hoping he continues to do that.
Yeah, that's very interesting stuff.
Yeah. So you're going to talk about a study about brain development.
I am. It was in the Journal of Pediatrics last summer, July 26th, 2016, and it is entitled Breast Milk Feeding, Brain Development, and Neurocognitive Outcomes, a 7-year longitudinal study in infants born at less than 30 weeks gestation.
Hmm.
So I wanted to digress for just one moment. The lead author, Mandy Belfort from Brigham and Women's Hospital in Boston, had a similar study that was published in JAMA in 2013 looking at term babies. And basically her intent here is to say that we've had some studies on looking at both neurologic outcomes and MRI characteristics of mostly term babies. Not so much has been done in preterm babies. And she's building on this study that she did in 2013, which was quite huge. There were 1,312 kids in that one.
Wow, that's
Uh,
good.
yeah, and it was a prospective cohort study
Hmm.
looking at the associations between breastfeeding duration and exclusivity with child cognition at 3 to 7 years. So this one didn't have MRIs involved, but was looking at, IQ and vocabulary testing and such at 3 years, and then again at 7 years. And what she found there was that the longer the kids were breastfed and the more exclusively, they were shown to have better receptive language at 3 years of age and verbal and nonverbal IQ at 7 years of age. And she broke it down into 0.35 verbal IQ points per month of any breastfeeding,
Wow.
or 4.2 points over 12 months. And then looking at the exclusive breastfeeding, it was 0.8 points per month, or almost 5 points over 6 months. So really breaking down, looking at exclusive versus any. But a weakness of it was maternal report in retrospect. So they were asking moms at some point between 6 and 12 months of age, how long did you breastfeed and when did you start feeding other things, which we know is not so horribly accurate all the time.
Mm-hmm.
But even so, you would guess that it's an underestimation of the power of breast milk. So that was in term kids and looking at them at 3 and 7 years with cognitive testing. So the one I'm talking about here is looking at preterm babies and both doing cognitive testing and MRIs to look at brain development. The other cool thing about it is they do it at each of those things at 2 different points in time. So it's kind of an elegant and complicated study looking at a very important and difficult to tease out topic.
Mm-hmm. Yeah.
Yeah.
Very hard, yeah.
A little more background, there have been a few studies looking at MRI growth, but again, mostly in term kids, that have shown increases in cortical thickening, especially in the adolescent brain with increasing amounts of breastfeeding. The authors state that there have only been 2 small studies in preterm babies that look at brain volume at 15 years of age and have found improved corpus callosum maturation at term equivalent age. But as always happens with these studies, some they look at different points in time and they use different measurements. There's only been 2 studies of very preterm or very low birth weight babies since 1990 that have looked at breast milk intake or amount of breastfeeding in relation to school-age developmental measures.
Mm-hmm.
One of them was a French cohort and found that the risk of, they actually just looked at non-optimal neurologic development at 5 years of age was substantially lower in infants who were breastfeeding when they were discharged. So again, this was just any breastfeeding versus no breastfeeding at the time of discharge, which was not a very specific measurement, but did show that 5 years of age they had less problems with neurodevelopment. And then a study in the U.S. showed no advantage of feeding expressed breast milk or direct breastfeeding through the first 6 months of age in these preterm or low birth weight babies at a battery of tests at 6 to 8 years of age. A major problem with this study, again, was with parental report of type of breastfeeding and duration of breastfeeding in retrospect. So she wanted to try and address that by looking at the amount of breast milk the kids were getting while they were in the hospital, and they decided to actually only look at the first 28 days, which is an interesting thing to do, but I guess the thinking was that there would be less attrition if they counted the kids that were getting breast milk in the first 28 days of life, and found that there was an association between still getting some breast milk at 28 days and still getting breast milk at 40 days, So they just looked at breast milk for the first 28 days and decided to, or I guess their hospital did not have donor milk available, so donor milk was not a part of the study at all. If mom did not have enough of her own breast milk, then preterm formula was given, and the breast milk was fortified routinely for premature babies. There were 180 participants in the study, and they were all less than 30 weeks gestation or less than 1,250 grams at birth. They were all born in Australia between July of 2001 and December of 2003. They were very careful about controlling for many different things: the infant's sex, gestational age, exposure to steroids, supplemental oxygen use at 36 weeks, any diagnosis of sepsis or necrotizing enterocolitis were combined into a clinical risk index, and then they created a social risk score based on maternal age, parental marital status, education level of baby's primary caregiver, employment status, and income of the primary income earner, and the language spoken at home. So in their discussion, the IQ was found to be 1/2 of 1 point higher for every additional day that the baby received breast milk intake of over 50% of their total enteral intake, and 0.7 points higher for every additional 10 cc's per kilogram per day of breast milk ingested. So the complicated matter in which they did this makes it kind of hard to describe simply, but basically the more breast milk you got, the more IQ points you could expect at 7 years of age. So they tried really hard to look at the effect of breast milk versus, more versus less. And just looking at that first 28 days, which is really kind of astounding. What we don't have is how much breast milk did they get beyond that. They really did not track that at all.
Wow.
How much?
Yeah.
But just looking at how much breast milk did these little guys get in the first 28 days made a difference in the deep nuclear gray matter, the thalamus basal ganglia, where the relay stations in the brain that are central to connecting the higher functioning, to the mid-level functioning of the brain. And then the hippocampus was also, which has been found in prior studies of non-preterm babies. The hippocampus was larger, which is, of course, for retaining information, memory, and learning things. And again, a limitation was that they didn't collect any information about how much breast milk the baby got beyond the first 28 days. They just looked at that first month.
Well, so it sounds like they did show a dose-response relationship. So the more they got, the greater those differences, right? Is what you're saying?
Yes,
Yeah.
absolutely. And the other interesting thing I thought was that they're saying that it's easier, it may turn out to be easier to quantify differences structurally in the young, in the toddlers and below than it is functionally to see the little differences at that age. But when you get up to 7 years, it's easier to see with testing functionally how their brain is working, but the differences structurally become less obvious.
I see.
Which it kind of makes sense to me.
Yeah.
That as it's developing, you see more difference, and then as the brain does what it does to try and be the best that it can be over time, you can't visibly see differences in volume like you could before, but you can see the effects of the optimal development along the way.
Right. Okay, so I think I'm going to leave it there. And it was great talking to you. And I will talk to you again in like a couple weeks.
All right. Sounds good.
All right. Yeah. Take care. Bye.
Thank you. You too. Bye-bye.
For questions regarding this podcast, contact us through themilkmob.org. We have other educational projects going on there, such as the Clinical Question of the Week and our Outpatient Breastfeeding Champion programs. If you want to see what we look like, check out our Facebook page, where you can also share comments and questions with your co-listeners. To learn more about the Academy of Breastfeeding Medicine, please visit www.bfmed.org. Thanks for listening. We'll be back with you in a few weeks.